There's nothing the internet can do to connect a patient with information that doesn't exist. But if information does exist, one of the things that we can do to make it easier for patients and families to find the information they need is make a concerted effort to publish in everything that we have in a way that will be easy to find. Now, there's a major problem there because Google and Bing, anything like that, is designed to show you the best information, and the way they try to figure out what's the best information is what other websites link to it. By design, it will never show you obscure information that's hard to find. So what I would like to see is a new kind of Google search or something like that that finds the less common information. So another problem is, for instance, medical journal articles that are not open access. Some people can get around that by, if they know somebody who works at a university, or some libraries will have a subscription. So if they go to the library, they can get at those. I don't know what to do about that because it's not a trivial thing because the journals need their funding. Maybe there can be some in-between sort of worker at the doctor's office or at a library or at a hospital who can find that information for you. It's better if people are actively managing their health before there's a problem. Human nature is that our mind tends to go to where there's a problem, and otherwise we tend to just live our lives. Who is defining what the priorities are for healthcare? What if 98% of people really don't care about taking care of themselves? Now, I think that's better, but do we want to have a government policy that says you have to care or you're going to jail? I believe that health care, everything about healthcare will improve if we start thinking first about what people want. First of all, not everybody wants to be an ePatient. My parents are a good example. My father said, let the doctors do their jobs. My mother, on the other hand, is a total ePatient. On the refrigerator, she has a printout of every medication she's taking, what doctor prescribed it, what it's for, how long she's been taking it. So if she ever is found on the kitchen floor, the ambulance driver will be able to see this. She's just totally responsible for her health in every way she can. But for people who want to be e-patients, we have a lot of work to do to give them the tools they want and to teach doctors to listen and want to work with them. Too often today, the main problem is that a patient wants to help, but the doctors say, who are you? You're not a doctor. I have incredible respect for the work that it takes to become a doctor. I was saved. My life was saved by several doctors. Each of them went through years of school and training and experience and specialization. There's no way that any e-patient I know could provide those services. But as somebody did all that work, you go through training in any profession, you acquire skills, and you come to realize, I know things that other people don't know. I'm valuable, I'm useful because I can do this, I know this information. What's happening with e-patients, with the internet, is that patients now have information that was not possible before. And they might even know information that their doctor has not seen. But that doesn't replace the skills, the trained mind, the analytical thinking, the approach to diagnosis, and all of that. There's this one thing, the access to information, that's changed. But so what do we do? How do we learn how to use this? It doesn't change what else was there before. So that's why, what I want to train patients how to use the information well. I want to train physicians I want to figure out with physicians how to do this in a way that makes life better.